Hello everyone, I'm Dr. Moses Kapi. I'll be giving a brief introduction on launching Prepaid 2.0, a multifunctional online tool for planning, monitoring, and evaluation of all forms of prep. A brief introduction about myself. I'm the Supervisory Project Management Specialist and the Head of HIV Prevention with USAID Nigeria. I am a UK General Medical Council certified doctor. I worked in the UK as an emergency medicine physician. I have several years of experience in public health. I currently work as the head of prevention and community programs at USAID Nigeria. This includes overseeing PrEP interventions for key populations. I also have background in maternal and newborn and child health, where I worked with the Nigerian Ministry of Health towards reducing maternal, newborn, and child mortality in Nigeria. I hold a postgraduate degree in public health and business administration. I have a strong interest in translational science. I have published several peer-reviewed articles on HIV/AIDS intervention. I would like to quickly introduce today's speakers. Dr. Catherine Kripke is a Senior Health Policy Analyst at Avenir Health. Dr. Catherine Kripke joined Avenir Health in early 2012, following over 25 years' experience working on HIV/AIDS and tuberculosis in the laboratory, and then in global health at USAID and NIH. At Avenir Health, Dr. Kripke mainly focuses on mathematical modeling and planning M&E tool development for HIV prevention. Dr. Kripke led the development of Prepaid. Omolabake Ekundayo is a Senior Population Program M&E Officer with the Nigerian Ministry of Health. Ekundayo Omolabake joined the Nigeria Federal Ministry of Health in 2001, but started working in the HIV/AIDS division in 2014 as a Population Program and M&E Officer, PACE Echo Focal Person, Viral Hepatitis Focal Person, Global AIDS Monitoring Reporting Desk Officer, and PrEP SI Desk Officer. She focuses on collation, collection, analysis, and reporting of HIV/AIDS indicators from the states at the national level, and also serves as moderator and facilitator for HIV/AIDS program. Omolabake led the PrEP-8 oral PrEP target setting exercise in Nigeria. Moses Otieno is a program officer with the Kenya Ministry of Health. Mr. Moses Otieno is a postgraduate fellow in global health leadership affiliated with the University of Washington. He has worked as a clinician with the faculty fellow public health consultant in the last 12 years. Moses is currently providing technical support as a program officer in PrEP and HIV testing at the Kenya National AIDS Control Program. He is part of the team that led integration of sexual and reproductive health and HIV prevention in Kenya, and the team applying Prepaid for PrEP target setting, quantification of PrEP commodities, and costing. In today's meeting, we'll be having two sessions and one Q&A panel discussion session. The first session will be Introduction to Prepaid 2.0, while the second session will be Learnings from Prepaid applications and how applications of the first version inform development of Prepaid 2.0. Session 1, Introduction to Prepaid 2.0, will be presented by Catherine Kripke.
Hi everyone. PREPIT stands for the Prep, Implementation, Planning, Monitoring, and Evaluation Tool. It was first developed in 2019 with funding through USAID. It's a decision-making and analysis tool with 6 interrelated modules, including tracking the PrEP initiation cascade, target setting, cost forecasting, estimating impact, forecasting PrEP product needs, and geographic prioritization of PrEP for adolescent girls and young women. So there are 2 primary purposes of the tool: program planning and implementation, monitoring, and evaluation, not meant to replace your existing monitoring and evaluation systems, but to provide additional analyses. Users can focus on aspects of the tool that are most suitable to their needs and ignore the other functions. So with the 2 purposes, there are 2 primary audiences. One is program planners, such as governments and donors, and the other one is PrEP implementers. So the governments and donors might be particularly interested in the targets, the costs, looking at coverage, tracking progress, and estimating impact, while implementers may be more interested in tracking the initiation cascade, projecting client flow and ARV needs, and then they may also be interested in projecting costs and tracking progress. Here's some more detail on PREPIT functionality. The target setting module sets targets by population group, so they can either be set based on a coverage target by priority population, or if you already have targets for numbers of initiations, you can enter them and then estimate costs, ARV needs, etc. using the tool. The target setting module produces annual and monthly initiation targets that account for continuation rates and scale-up trends, and these targets can be disaggregated. The cost module estimates the costs of targets. These are organized by visit type. So for example, initiation visits and continuation visits are associated with different costs, and these costs account for different continuation rates and visit schedules by population. The users can also enter above-site annual lump sum costs. The PrEP product forecasting module forecasts PrEP product needs based on targets. It takes into account continuation rates and scale-up trends. There's the impact module, there's the AGYW module, which identifies localities where adolescent girls and young women are in particular need of PrEP. And then there's the module for tracking the initiation cascade, which displays cascade metrics from HIV testing to initiation. The tool can be applied at the national, subnational, donor, implementer, or site level. This year, we have released a new version of PREPIT, PREPIT 2.0. The first version of PREPIT was initially implemented in Microsoft Excel, and in the past year, through the USAID-funded Promise collaboration, we moved from an Excel-based tool to an online version, and this gave us some power to include some additional functionality. So now we have been able to include the PrEP method mix, meaning oral PrEP, the PrEP ring, injectable PrEP when it comes online, etc. There's also the ability to compare and compile program data and targets across subnational geographic units. Then the online tool includes an improved user-based interface with easier navigation as well as templates to facilitate data entry. A number of countries have already applied PREPIT, so Eswatini, Malawi, Zimbabwe, Nigeria, and Kenya have used PREPIT for national target setting, and Kenya is actually in the process of using PREPIT version 2.0 for county-level oral PrEP target setting. You'll be hearing from stakeholders from Nigeria and Kenya in a moment about their experience using the tool. And in addition, Ghana, the Philippines, and Vietnam used PREPIT for ARV forecasting. Here are some resources for PREPIT. The web version is available at prepitweb.org. If you have any questions, you can send an email to prepithelp@avenirhealth.org. And the tool, as well as supporting materials, can be found at this website on PrepWatch. Here's the PREPIT team of developers. We would also really like to thank a number of collaborators in several countries. Really, there are too many to name, but we have had so much input from potential users, actual users throughout the development of PREPIT, and we look forward to collaborating with you to make PREPIT even better in the future. So now I'm going to do a quick demo of PREPIT online. So here we are at the tool, and you can see that on the landing page you have to decide whether you're going to use the full tool or aggregate other sessions from smaller geographic areas. So we're going to look at the full tool here. And that brings us to the Getting Started page. On this page we're going to configure the tool based on what functionalities we want to use. I should also mention that on here is the navigation menu. You can go back and forth in different modules of the tool. Here is the help functionality, so based on what page you're on, it will show you some tips about what's going on in that particular module and how to work with it. There's also, you can look at all of the help and look at different topics in the help index here. Another important feature to notice is that the tool doesn't save your work on a server anywhere. If you want to save any of your inputs, any of the configurations, you need to download the session. This saves a file on your computer, and then when you're ready to come back to use Prepaid again from that same session, you upload it and find that file, upload that particular file. You can also use this to share that session with another colleague and ask them to review or put in some different inputs. You could also use it to send it to Avenir Health if you're having a problem. So once you have answered all of these questions on getting started about how you want to use the tool, if you want, you can press this. So this has been configured by these questions. You can press this button, Generate Data Template, and it will download a template that focuses on those inputs that you need for those particular functionalities that you've told the tool you want to use. And you can pass this template around among different stakeholders, have them review it, have them put different inputs. You can document the sources of your inputs, any assumptions here in the template if you want, or you can enter the data directly into the tool. So if you're using the template, then you would upload it here into the tool, and then we'll go through the different steps. So based on the selections that I made in the Getting Started page, I need to define my priority populations. If I want, I can add my own priority populations in addition to those that are appearing here by default that have default data associated with them. I will need to tell the tool which methods I want to look at, and I can look at pill, ring, or cab LA, or I can add custom methods here as well. So I might only want to look at the pill, or I want to set targets for both pill and ring, and depending on which methods I have here, I need to put in some additional data for that. And then we need to define the continuation rates. So this is important because most of the calculations in the tool are using the continuation rates. So this is a continuation curve, and it represents, for this particular curve, the percentage of clients who have returned for PrEP visits at 1 month, 3 months, 6 months, and 12 months post-initiation. And then each of your priority populations needs to be assigned to a particular continuation curve. And so this means if you start PrEP, you're not necessarily going to continue it, so the costs, the product needs, the impact, they're all going to depend on the continuation rates of each population. If you are entering program data, you would do it here. You indicate the period of time for which you're entering the program data. If you want, you can download a template based on the inputs that we had. It's showing each month of the program data period, the indicators that you selected that you want to upload here. In this case, it's just only initiations. And then for each of the populations, I'm going to put the initiations for each month of the program data period, and then upload it into the tool. And then we go through the rest of the modules. So there's the cost module. If you want, you can use that adolescent girls and young women geographic prioritization module, the impact module, the targets module, and each of these modules has several different screens that you have to go through and put your inputs and then get your results. Once you're finished, all of the outputs are going to be compiled here in the results dashboard, so that this is showing the results from the different modules.
And then if you want, you can disaggregate your targets, and you can also do commodities forecasting. So that is the end of this introduction to the tool, and thank you for your time and attention.
Session 2, Learnings from Prepaid Applications in the Field, will be presented by Omolabake Ekundayo from the Federal Ministry of Health in Nigeria.
Good day, everyone. My name is Omolabake Ekundayo. I work for National AIDS and STI Control Program of the Federal Ministry of Health in Nigeria as a monitoring and evaluation officer. I'm here on behalf of the national prep team to present Nigeria's experience on the use of Prepaid. First of all, I would like to take you through the national progress on oral prep so far. From 2015 to 2018, we had the prep demonstration projects in 3 states, Anambra, Plateau, and Cross River State of Nigeria. 2016, we developed national guidelines for HIV prevention, treatment, and care included prep for serodiscordant couples and key populations. From year 2017 to 2021, we developed a national strategy framework on HIV and AIDS included prep. In year 2020, we reviewed our national guidelines for HIV prevention, treatment, and care, which included prep for exposed adolescents and young people. In year 2021, we developed a 2-year implementation plan and roadmap and strategy document. In year 2021 also, we developed a consolidated service delivery guidelines on HIV and STIs for key populations in Nigeria. Lastly, we developed PrEP data collection tools and rolled them out. These are the steps for application of a Prepaid. We conducted a national training for national team on the use of the tool. We conducted stakeholder meetings to agree on necessary data input. We also compiled data and entered into the tool. We conducted stakeholders meeting to validate the data input and assumptions. We also conducted stakeholders meeting to review targets and other outputs, followed by reviewing the target and also finalizing the targets. These are the advantages of the Prepaid version 1.0. It is user friendly. It helps to generate quality and accurate output by month and state. It also helps us in monitoring monthly program data on the cascade of PrEP delivery. It is also used to forecast the number of drugs needed based on target. It also shows the impact at the end of the target setting period. Lastly, it helps to track service delivery progress against our targets. These are the disadvantages. It was too complex and requires continuous use and practice for MIE and program staff with little or no experience around data estimation to understand the concept and calculations behind this tool. Secondly, data collection from the prep implementers for input on the tool was quite challenging, as the country was yet to roll out harmonized prep data collection tools as at the time of data entry on the tool. Then, understanding and building consensus of the key stakeholders on the assumptions used during the data entry on the tool took a lot of time and a couple of meetings. These are how the challenges were resolved. We conducted 5 virtual meetings with hands-on training by Venia Health Prepaid lead on the tool in April and May 2021. We also had input from all stakeholders comprising of prep implementers, donors, Avenia Health, and GON representatives. All these were considered and applied on the tool. We also developed an indicator template, which we shared with all our prep implementers for collation in April 2021. With the introduction of the Prepaid 2.0 online version, it is more user-friendly than the Excel template. And lastly, it also includes templates that can facilitate data collection from prep implementers. And with this, we plan to use the online version soon. Thank you all. This marks the end of my presentation. Thank you all for listening.
Also, as part of session 2 on lessons learned, the use of Prepaid for target setting in Kenya will be presented by Moses Otieno from the Kenya Ministry of Health.
Yeah, PrEP as an HIV biomedical intervention was launched in Kenya in May 2017. Until this year, setting targets for PrEP has been erratic. The program and the health partners had different approaches and process of target calculations, and this was confusing to PrEP implementation, health facility in charges, and the managers. Indeed, the PrEP target setting remained a concern of the program for the longest time. When you first heard about Prepaid, the Excel version, sometimes 2019, we embraced it not only because it came at the height of our desperation, but it also had additional functions, which includes cost forecasting, ARV forecasting, estimating impact, and program monitoring, and capacity assessment. Also include efficiency analysis. We quickly formed a team that was taken through the tool in early 2020, but COVID-19 slowed the team's efforts. The team will later pick up the process from late 2020 and made presentations of the tool to the Monitoring and Evaluation and Research Subcommittee, who eventually approved the use of the tool in April 2021. The Excel version of the tool was used by the PrEP program to set the national and subnational PrEP targets for 2021-2022. The targets were disseminated to the counties. However, there was a small difference with the PrEP targets from partners and estimation for forecasting and quantification for the same period, which had taken place earlier in the year. Prepaid has since improved from the Excel to the online tool, that is Prepaid 2.0. The new tool was developed as a result of inputs, positive criticism of the earlier version of the tool, and the interest most countries in Africa had in the tool. Kenya set a pace on this. The online tool is easy to navigate, user-friendly, less labor-intensive, and less technical in nature, with the additional function of geographical prioritization of PrEP for AGYW. As a program representative of Prepaid, together with our partners from LVCT Health and with the support from Urban Health team, which developed the tool. We have gone through the tool severally, and I can simply say we are well trained and we are tool experts. At the end of September, that is from 27th to 29th, we managed to train 18 trainers of trainees on the online version of the tool with a representative from national, subnational, and health partners. The approval of the tool by the participants was overwhelming, and the rating of the tool stands at 8 out of 10. In any case, you don't have an alternative. With a few suggestions for improvement and Prepaid becoming an household name in PrEP program in Kenya, the rating will be top on the mark. We wish to roll out the training to sub-national level using the TOTs in the coming weeks. As a country and as a PrEP program, the tool shall be used for PrEP target setting, cost forecasting, and ARV forecasting. It shall also help in estimating impact and tracking the cascade of PrEP delivery. We have agreed on primary input variables that include the population types, the HIV prevalence per population type, the estimated population size, the continuation rates, the PrEP schedule visits, and the program data, and all the other variables needed. We are system go with the online version of Prepaid. The tool is good and best fits our need as a program. We are privileged to be the first country in Africa to use Prepaid 2.0, the online version. And therefore, Kenya highly recommends Prepaid 2.0 to be used in other countries for target setting and forecasting for ARVs and costing. And we are more than ready to support other countries when called upon. Prepaid Online is the way to go. With all its functions, it is the best tool. Thank you.
M&E insights from Prepaid applications will be presented by Catherine Kripke.
By way of introduction, let's review current global indicators for PrEP. These include the number of clients newly initiating on PrEP, those continuing for a specified period, or the number currently on PrEP. Prepaid can forecast the number of clients who need to initiate PrEP to reach a specified coverage level. In other words, the proportion of clients currently on PrEP in the last month of the target setting period. Experience with oral PrEP has shown that most clients discontinue PrEP at some point over the course of a year after initiating PrEP. One important feature of Prepaid is that it factors in PrEP continuation rates when determining targets, estimating costs and impact, and forecasting commodities in order to avoid over or underestimating the number of persons on PrEP and the associated costs and impacts. However, continuation rates are difficult to extract from program data, especially where paper-based client records are used. They require individual level data, while many programs do not have unique client IDs for PrEP programs. In addition, they don't represent actual patterns of prevention effective use. Some clients reinitiate PrEP multiple times during the year. Prepaid does not distinguish between initiations and reinitiations. So we asked ourselves, how can Prepaid better reflect actual PrEP implementation while using readily available data as inputs? While continuation rates may be difficult to collect and are not representing well appropriate discontinuous use of PrEP, the existing indicators are also difficult to collect, and they may penalize programs in which clients are appropriately using PrEP discontinuously. Collecting numbers of clients newly initiating, those continuing for a specified period, or numbers currently on PrEP also fails to provide insights into the total amount of PrEP use over the course of a year, given the discontinuous nature of PrEP use. Therefore, it's difficult to estimate the impact of the program and coverage of priority populations. One possible solution would be to replace indicators counting numbers of clients continuing for a specified period of time, or the numbers of clients currently on PrEP, with indicators of the volume of PrEP dispensed by priority population. This would enable the use of existing information already collected in both electronic and paper-based systems. The volume dispensed could come from pharmacy or other dispensing records, and information about priority populations served could be collected through new indicators about numbers of visits that could come from clinic records. These could be tracked by PrEP method, And they would provide a better estimate of the total amount of PrEP use within each priority population than the other existing indicators. They would also assist with better target setting, budgeting, and product forecasting. Materials providing additional discussion and background on this proposal for new indicators can be downloaded at the URL shown on this slide, avenirhealth.org/M&E.